Hello, I'm Dr. Veena Ramachandran. I'm a consultant rheumatologist practicing in Bangalore. Are you constantly struggling with dryness in the eyes and dryness of the mouth? It may not be mere dehydration. It could be something called as Sjogren syndrome. What is Sjogren syndrome? Sjogren syndrome is an autoimmune condition where your immune system can cause dryness by attacking the salivary as well as the lacrimal glands. It can also affect other parts of your body. It can sometimes present on its own, which is called as primary Sjogren syndrome, or can be associated with other autoimmune conditions like systemic lupus erythematosus, rheumatoid arthritis, etc. What are the usual symptoms that patients feel in Sjogren syndrome? As a part of dry eye, patients can present with grittiness in the eye, burning sensation in the eye, feeling of pricking or a foreign body sensation in the eye, can have redness in the eye also. As a part of dryness in the mouth, patients can have varied spectrum of symptoms like frequent dental caries in abnormal spaces like the front teeth, difficulty in swallowing, difficulty in chewing dry foods which they need to take sips of water every time after intake of food. They can also sometimes present with joint pains, fatigue, swelling of the salivary glands which can be sometimes recurrent, and Sjogren syndrome can also cause organ involvement like involvement of the lung, involvement of the kidneys. So how is Sjogren syndrome diagnosed? It can be diagnosed by an eye specialist by doing a simple test like the Schirmer's test, and following that, if they objectively check and figure out that the tear secretion is reduced, they may do a series of tests to confirm the changes which is there in the eye. A set of blood tests can be done which includes performing the ANA as well as the ANA profile, and specific autoantibodies which is associated with this disease is checked for. In the beginning, when you visit your doctor, of course, a detailed history and examination is done in order to establish what are the symptoms and what are the organ systems which are involved by the disease. Very rarely, we have to perform a lip biopsy in some patients to confirm our diagnosis. Let's look at what are the treatment options. Of course, as of now, there is no cure available. But with the current medications and the medical supports which is available, the symptoms can be very well managed and patient can have a comfortable life. So what are the options that we have? For the dryness in the eye drops which are lubricant, preservative-free eye drops which is useful for preventing dryness in the eyes. Hydroxychloroquine is a drug which we use if the patient has persistent joint pains and swelling associated with Sjogren's. Immunosuppressants can be used if there is organ involvement in patients. So based on the spectrum, the organ involvement and the disease severity, we have to tailor the treatment for every patient. Sjogren's is not just a nuisance. It is a disease which needs medical attention, and if picked up early, if given attention and treatment early, can be controlled very well and can keep the quality of life for our patients. So, if you have any of these symptoms, make sure to consult an expert at the earliest.